This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks so much for joining us for USVI News. I'm Emily Matson. As COVID cases continue to surge because of the highly contagious Delta variant, unfortunately, as we've been reporting, the USVI has not been spared. VI Governor Albert Bryan Jr. addressed the latest on COVID-19 in the territory during this week's news conference. Our USVI News' Ali Bourne-Vinek brings us all the latest details.
Emily, the numbers continue to go up when it comes to COVID-19 in the territory. According to the Department of Health, we now have an escalating 208 cases of COVID-19. The breakdown of that includes 61 on St. Croix, 141 on St. Thomas, and 6 on St. John. Another alarming number includes the amount of people hospitalized due to COVID-19. That number is 21, and according to the Department of Health, that is the most at any given time that we have had hospitalized since the pandemic began. The governor says that out of all of these people who are hospitalized, none of the patients were vaccinated. He's encouraging everybody to double down, stay as safe as possible, because if this surge continues, restrictions are on the way.
Virgin Islanders, we are approaching the point of reimposing restrictions as we currently have 208 cases. The majority of these cases are in the St. Thomas and St. John district, but St. Croix ain't too far behind. There is no question that we are experiencing another surge, and as such, we have requested temporary support and additional resources from PAFFORD to come in and help our hospital and supplement the limited manpower we have while we go through this surge. We need everyone to heed the request to be extremely cautious over the next couple of weeks and to really hold it down. I don't think we need to experience what the BVI has experienced for us to learn. Like I've said many times before, when your neighbor's house on fire, throw water on yours.
Another concern in the territory is how will this surge affect the start of schools? As of now, schools are set to begin in person in August, but the governor shared that this is a situation we will have to continue to monitor, especially if the surge gets worse. In St. Thomas, Ali Bourne-Vinek, USVI News.
Thank you, Ali, for that update. And as cases surge here, a handful of states are actually driving a nationwide increase in COVID cases. And while vaccinations have crept upward a bit, pressure is building for a return to mask mandates, although here in the VI, mask mandates haven't really gone away. So here's what's happening across the nation right now.
The highly contagious Delta variant is driving COVID spikes across the country, with roughly 100 million eligible but still unvaccinated Americans giving the virus room to spread.
With that many unvaccinated people going into the fall, with the Delta variant as efficient as it is in transmitting, we could have a really serious problem with a considerable surge of infections.
In states with the biggest surges, vaccination rates are ticking up, but not quickly enough. Today, as businesses and employers debate whether to mandate vaccines, a coalition of 56 leading medical groups says all healthcare workers should be required to get the shots to protect themselves and their patients.
Well, we assume that when our healthcare workers are there to take care of us, that they're also not going to harm us with an infectious disease that they may carry.
More local governments are now mandating masks again. Today, St. Louis joining Los Angeles and New Orleans requiring face coverings indoors. And federal health officials are weighing new mask guidance for vaccinated Americans.
This is under active consideration.
Citing concerns over the Delta variant, the Biden administration is extending foreign travel restrictions imposed at the start of the pandemic.
The Delta variant is fueling a surge in COVID-19 cases across the country, as you've just heard, mostly involving, again, unvaccinated people. And now we're hearing from two healthcare professionals on the front lines who say patients are regretting their decision not to get vaccinated and begging for the shot before being intubated. Here's their emotional plea.
An emotional call to action from two healthcare workers who say their unvaccinated patients are regretting not getting the COVID-19 shot.
They come into the system and they early on, they say, can I get vaccinated? And at that point you can't. If you already have symptoms, you're unable to get them.
Alex Sikarsky, an intensive care clinical nurse manager at Miami's Jackson Health System, says she's dealing with a very young population of COVID-19 patients.
They're dying in the early mid-20s, 30s, 40s, and 50s.
COVID-19 infections and hospitalizations are both rising across the entire U.S. Data from the CDC shows the U.S. is averaging more than 40,000 new COVID-19 cases each day. In another moving testimony, Dr. Brittany Kobia wrote this Facebook post about young people arriving at her Alabama hospital seriously ill with COVID-19. One of the last things they do before they're intubated is beg me for the vaccine. I hold their hand and tell them that I'm sorry, but it's too late. Dr. Kobia also writing that when patients don't make it, she tells family members to honor their loved one by getting vaccinated and encouraging others to do it too. It's the same message coming from others on the front lines. Get the shot.
We really want to make sure that everybody understands that we really need your help to help you.
According to the CDC, unvaccinated people who get COVID-19 and have symptoms should wait to be vaccinated until they have fully recovered. A Florida court has reversed its decision, which allowed the government to implement COVID-19 protocols for the cruise industry. The CDC requires cruise lines to meet certain conditions before they can set sail, including ventilation, social distancing, and testing for COVID-19. Florida initially won when the state went to court to block the CDC's protocols, but then a federal appeals court sided with the CDC, leaving the rules in place as of now. But now an appeals court has ruled the CDC failed to prove its jurisdiction in the matter. The cruise industry will now be able to resume operations in Florida without adhering to CDC's COVID-19 protocols. But it's a temporary win for Florida. The court requested the CDC file an appeal to support the agency's argument by September 1st. The cruise industry is starting to come back in Juneau, Alaska. The first large cruise ship in almost 2 years finally arrived back on Friday. Reporter Sean McGuire has the reaction from businesses and passengers who, just like us, rely on this industry.
After close to 2 years of waiting, the first large cruise ship arrived on a drizzly day in Juneau. 632 passengers spilled onto the streets.
Have a great day. Thank you.
The Serenade of the Seas is roughly 1/4 full. As sailings continue through October, the plan is to incrementally increase capacity as COVID-19 protocols are tested. For the passengers on the 7-day Alaska voyage, there was excitement.
It's been fantastic. So we had originally planned on doing this last year, so waiting a little bit more time makes it a little sweeter to finally be on the road, or I guess on the water.
It was nice to get to see the icebergs and the glaciers and stuff, but I'm really excited to get to see the whales and the bears and all kinds of things that we wouldn't normally see.
Tour vendors were excited too. They were there ready to sell trips.
It's good, it's weird, it's kind of surreal, honestly. It's familiar, but it's kind of a lot of nervousness at the same time. It's just been 2 years since we've really worked.
But a shortened season with fewer sailings does have its impact.
I mean, a normal year, yeah, there'd be like 10,000 people.
Float planes were soon flying. Small boats got ready to head out, and busloads of people drove to take photos of the ever-popular Mendenhall Glacier. For the city and borough of Juneau, this is a hopeful moment. Cruise ship passengers typically account for 20% of the city's annual sales tax revenue.
I'm just so excited. I'm just so happy.
Laura Martinson owns Caribou Crossings, a downtown Alaska art store. She says the last 21 months have been a roller coaster, and she came to see the ship sitting in port.
Feeling like we're winning. Some days you're on top of the world, and some days you feel like you're just never going to make it. So, it's emotional.
The ship arrived just hours before the city reimposed restrictions to curb a spike in COVID-19 cases. But that wasn't going to stop the joy of seeing a critical engine of the state's economy return to Juneau.
For me, this is like a giant beacon of hope, where it feels like we're going to make it.
Juneau, Alaska, a much different climate than ours, but when it comes to the cruise industry, same issues they're facing. Well, it seems rising COVID-19 cases within the Olympic Village in Tokyo isn't the only thing trying to get in the way of competition. Steamy temperatures continue to plague the Tokyo Games. Temperatures in the city have hit the 90-degree mark almost every day. The heat prompted organizers to move marathons and other race events from Tokyo to Sapporo in the north. But the severe weather may intervene there as well after forecasters predict a typhoon to make landfall in northern Japan on Tuesday. Folks in Tokyo said today they're concerned about the athletes and the hot weather there. So with tropical weather forecast to approach Tokyo within days, Olympic organizers say they're talking with individual sports about changing event programs. The Tokyo Olympic sports director says they are closely discussing issues around the severe weather forecast. Rowing already cleared its schedule for Monday and Tuesday, moving some events forward to the weekend and others back to Wednesday. The storm they're calling Napartek formed on Friday and is most likely going to make landfall sometime Tuesday. It's unclear whether Tokyo will be in the center of the storm.